Thanks for coming today. I'm Courtney Clemens, and this is my brother Jason Clemens. In our family, we have 3 U of M graduates. This is the oddball that went to St. Cloud, but we're happy to be back here today. So today we're going to talk about a sarcoma misdiagnosis that happened with our family. So here's a picture of our dad, Bill Clemens, looking like a rock star back in the 70s. He had a history of knee problems. He was actually honorably discharged from the Marines during the Vietnam War. When he was younger, he was an athlete and trying to make that slide into home plate. We think injured his knee at that point. And then he also had orthoscopic surgery in the mid-'80s. So he did have a little bit of a history of a knee problem. And then they started to reoccur again in fall of 2008. So he went to visit his primary doctor in October, and then it was followed up with an MRI in November. At this point, they referred him to an orthopedic surgeon, and some of the things that they started doing was some physical therapy and then doing some lubricant injections to help with his knee problems. Also did a Lyme's disease test, but ultimately, a lot of this was making his knee more swollen. I mean, you should have seen the size of it. It was huge. He was having a hard time walking, he was in a lot of pain, and he was even having to use a cane kind of coming up in January and February to get around. So he pushed to get a knee replacement surgery in March 2009. So when he went in the beginning of March, the pre-op nurse was even alarmed at the amount of Vicodin that he had been prescribed and taking daily to help manage his pain that he was in. So when they went in to do the knee replacement surgery, the surgeon discovered at that time that it was a tumor, and it was a rather large tumor at the notes. It was 8 by 7 centimeters. Instead of taking a biopsy at the time, he proceeded to take out all of the tumor and then complete the knee replacement at that time. Because in his mind, he thought it was a benign tumor called PVNS. So, unfortunately, 9 days later, the biopsy did come back, and it was called synovial sarcoma. So at that time, the surgeon immediately referred us to Dr. Chang here at the U of M. And on our first visit, it was just heartbreaking to hear from Dr. Chang that when he looked at the MRI that was done previously 4 months ago in November, that he could see that it was a tumor at that time. So at that time, too, the prognosis was grim. He had only given our dad 15% chance of survival. And a few days later, we had a full body scan, and we were able to see that the cancer had metastasized to his lungs at that point.
So at that point, he was going to be going through some chemotherapy. He went through 4 intensive rounds prescribed by Dr. Skubitz. Each time he was taking them at home. He was taking the backpack, and it lasted a week for 24 hours a day. The tumor was shrinking down in his knee, and they decided that at that time they figured the best approach was to amputate his leg. That was done in July of 2014. And that was to help stop the spread of the tumor in his legs, or in his knee. He wanted to walk again, so he pushed to have bone graft put back in, so he could be able to get a prosthetic at a later time. But because of during the recovery from that amputation surgery, he wasn't able to do chemo, and the tumors came back stronger in his lungs. He went through some additional rounds of chemotherapy. I'm not going to pronounce these ones. But the tumors eventually got to be really large in his lungs. The one was about the size of a grapefruit. And because of, during that last week, he was admitted to the U of M on November 23rd due to low oxygen levels, and he passed away 2 days later on November 25th at the age of 58. the whole time he had a positive outlook and said that, we can't bury our heads in the sand and we have to fight this, and it's too bad that, it was misdiagnosed as much as it was early on, because it would have been interesting to see what the fight would have been had it not metastasized to his lungs. He also, he had fun with it too, with his, he got to joke that he got to be a peg-legged pirate for Halloween, with his one leg, and yeah.
So we have a couple of takeaways that we hope that you could get from today. Dr. Ogilvy already went through a few things in his lecture, but just to listen carefully to the patient's symptoms and how much pain that they're in. And if you're unsure, don't be afraid to refer to your colleagues for a second opinion on an MRI or a diagnosis. And like he had mentioned earlier too, during operations, if you find a tumor or a mass that's over 5 centimeters, to definitely have a biopsy done. And then here's where you can learn more about some of the red flags of sarcoma at reinsarcoma.org/redflags. Thank you.